Hello and welcome back to Beauty Doctors by Cocoona. I'm Dr. Sanjay, I'm your host. The recent research by International Society of Aesthetic Plastic Surgeon shows a huge increase in cosmetic procedures over the last few years, almost 150% of the growth. Amazing. And the most popular procedure, of course, is face, but after face is breast. Breast is a very sensitive issue, and unfortunately, there's not much resource available for education. Let's find out more about breast surgery. I have with me here today Dr. Mazen Arafa, specialist plastic surgeon from Cocoona.
Hello.
Welcome, Dr. Mazen, and thank you very much for sharing your experience and knowledge with us.
Thank you, with pleasure.
Now tell me, breast lift. It's a very popular request from people. Are there any tablets that can help breast lift?
Definitely yes, it is, especially in the Middle Eastern area where pregnancies are quite often and breastfeedings are quite often. In fact, we have multiple pregnancies and multiple deliveries, sometimes 6, 7, or 8. And also weight loss is a very, very common thing, which is definitely positive nowadays in the Middle East. So we have a lot of, first of all, breast volume loss, and second of all, a lot of skin sagginess that happens with these two things. Of course, aging can also cause breast sagginess or breast ptosis, just even without any weight loss, or even when women that never had breastfeeding. What is a breast lift? Breast lift is actually restoring the natural shape and position of a breast. So whenever the breast is underneath, or let's say the nipple areola complex is below the line that is going underneath the breast, that we call the inframammary fold or the inframammary crease, in that case we need to restore the position to the normal one, which is above the crease. So in these cases, pure breast implants don't really do the job. In fact, sometimes they can even make things worse. And there's a lot of speculation about which breast is for lifting and which breast is only for other procedures like silicone implants. And that can only be determined by a plastic surgeon who is experienced and qualified enough, because there's a lot of tricks and there's a lot of measurements that need to be done and a lot of science that needs to be established to be able to tell which surgery is perfect. So my first advice to people, yes, read on the internet. You need to understand that internet is a very powerful tool for educating yourself and for knowing a lot about everything. But at the same time, it's a very, very powerful tool for manipulation. And there's a lot of parties that have a very wide interest on selling the implants, or for example, or selling some non-surgical means, selling some creams for breast lift. We even heard about that.
Even pills,
completely
tablets.
absurd. Pills and tablets and collagen tablets. It all has a certain sense, but not for every case, and not without a good assessment from a good plastic surgeon that will help you to make the decision and to help you to get the right result.
So how would people know what they need and who should they go for?
So first of all, definitely a consultation of a proper expert is needed. There's no such thing as you yourself assessing the case and determining which surgery is best for you. And again, there's a lot of wrong assessment happening from relatives, friends, and my friend did this surgery and she was happy about it. There's no such thing as a same condition in two people, even in twin sisters, not to mention other different relations. So definitely, first step is to come for a consultation, to get the breast assessed, and then to get all the options. Your surgeon will probably give you a few options in which you would probably get the most perfect possible shape, but with a tiny bit more scars, or less perfect shape with less scars. But again, you'll have all the options and you'll have everything cleared completely. The problem is if you go for a milder surgery and you try to lift the breast, and you don't succeed in that, and the breast drops again, and you go for the second surgery will never give you as perfect result as if the right thing was done right away. So it's very, very important to get a doctor you trust, a clinic you trust, to get the proper assessment, proper opinion, and to be shown to you what will happen and why do the scars need to be there. And anyway, all that theme about the scars on the breast, no matter how annoying they seem to be, but they end up being much, much better than most people would expect. And actually they go so discreet and so mild over time that actually most women don't really bother. So it's either perfect shape with scars or imperfect shape without the scars, and the first option is definitely much, much better.
What about the injections? I've heard a lot of stories and a lot of people saying that injections could help. Patients keep coming asking to me, what about injections? What about no scar left?
Again, going back to all the parties that were trying to benefit from the manipulation of the internet, there's no such thing as breast lift without scars, and there's no such thing as correcting significant breast sagginess with only injections. There's only, some people call it old school plastic surgery. It's not really old school plastic surgery, it's scientific plastic surgery. And science and plastic surgery can just analyze physically and ergonomically what is the requirement of the breast and just deliver it properly. So if there's anything that can be done without the scar, your plastic surgeon can definitely do it, and he will definitely suggest it. But if he says that it's not achievable, don't get manipulated by other parties which are obviously trying just to use the attraction of getting a breast lift without a scar, because these substances, and we had a lot of cases of that, can cause catastrophic consequences, sometimes even cancer, but in most cases at least deterioration of the breast, very, very bad shape, and something that cannot be corrected anymore. And these substances and these injections, if you want to remove, you need to just remove the whole breast and reconstruct it all over again, which is really a catastrophe compared to just getting a straightforward breast lift, which will give you the perfect result with, again, as we said, really minimal scarring.
What about breast implant? Do you think breast implant can correct lift?
In some mild cases of breast sagginess, breast implants can deliver a good lift. But that definitely needs to be assessed by a surgeon, and in the same time, you need to first of all understand that getting larger implants to correct the sagginess, which usually happens, so surgeons trying to fit in larger implants to correct or to stretch out the tissue, would definitely lead to more and even more severe sagginess of the breast because of the heaviness that happens. So if you trust your surgeon, and if he says that breast implants can correct your particular case, then it definitely can be done. Otherwise, be aware of fitting large implants, which will lead to even more sagginess, and then you requiring even surgeries with even more scars than the initial one.
But that's interesting. I mean, one would think that bigger the implant would mean bigger lift. What do you think?
Immediately, yes. But that will last for maybe the first 6-7 months, when the breast tissue will start losing up. Because one of the things that we achieve on a breast lift is giving support to the breast, anchoring the tissue of the breast with certain internal stitches that we do, and that will actually give us long-term stability of the breast. And fitting only the implant, then you're relying on the tissues of the breast to hold the breast. And with the heaviness of the implant, definitely it will sag. So in some cases, definitely it can be achieved. But in a lot of other cases, not really. It's just, let's say, a quick trade-off for an immediate nice result with no scars, with a late catastrophic, again, even more sagginess than before.
But you do understand that scars are always a concern for people, and they don't know what kind of scar they will help. So how can you, first of all, give them some idea about what kind of scar they could have, or what would you do or give extra effort to minimize their scars?
Absolutely, yes. So we always have a few options in every surgery. So whenever we see that there's even a 20 or 30% chance that the patient will get away with less scars, we will definitely try and force that option. But according to our experience, there are certain types of tissue and types of skin. So whenever the surgeon, by his experience, just predicts that the breast will sag with time and will not hold the result for a period long enough, then in that case, the patient needs to understand that they are trading off scars with good shape. And good shape is definitely the priority. So with clothes on, with swimming suits on, these scars are very, very intelligently hidden, and they don't really show to the public. And trading off the scars for a worse shape would again look bad in clothes and without the clothes. So yes, in some cases we try to force as much as possible. First of all, we use very, very specific and high quality sutures. We use very modern techniques. We use a lot of let's say, additional tools like surgical glues, for example, or special tapes that would just give the wound more support and produce even less conspicuous scar. But in certain cases, whenever you need to give the breast a certain support, then at least the vertical scar would have to be there.
Thank you very much, Dr. Mazen. That was very useful, and I hope there was a lot of information for you If you have any more questions that you want me to ask our specialist, please write to us. Thank you very much and have a good day.
Thank you.